Hi, my name is Colleen Brummett, and I'm going to be doing a presentation on ototoxins and hearing loss. What are ototoxins? Ototoxins are chemicals that cause hearing loss. They enter the body through ingestion, inhalation, and skin absorption. They travel through the bloodstream and eventually damage the auditory nerve or the cochlea in the inner ear. Hearing loss related to ototoxins can derive from medication, industrial chemicals, and noise. Certain medications that cause damage to the ear are considered ototoxic. Damage can include hearing loss, ringing in the ear, as we know as tinnitus, or balance disorders. What's happening in the ear? So ototoxin agents travel through the blood and are soaked up by the auditory nerve. Hearing loss occurs as a result of the damaged auditory nerve or the sensory hair cells dying in the inner ear. Ototoxic agents affect this area of the ear, labeled as the inner ear, which is the cochlea, the semicircular canals, and the nerves. What are some symptoms of ototoxicity? Tinnitus or ringing in the ears, as we discussed, bilateral or unilateral hearing loss, dizziness, incoordination in movements, unsteadiness, or oscillating or bouncy vision. How is this diagnosed? There are many different tests an audiologist can administer to determine ototoxicity. These typically should be performed before an ototoxic agent has been administered, during, and after. Some hearing and balance tests to administer include pure tone air conduction testing, pure tone bone conduction testing, word recognition tests, Romberg's balance test, and high-pitched testing. So as for medication, there are over 200 drugs that are considered ototoxic. These specific medications are used to treat cancer, serious infections, and heart disease. Certain drugs are known to cause permanent hearing loss. These include aminoglycoside antibiotics such as gentamicin and cancer chemotherapy drugs such as cisplatin and carboplatin. However, some ototoxic medications cause only temporary hearing loss. These include, but are not limited to, alicylate, pain relievers, quinine, and loop diuretics. These are used to treat pain relief, malaria, and heart and kidney disease. So some recent literature to go off of that. In the last year, the University of California and the University of Wisconsin-Madison evaluated the effects of ototoxic agents on the geriatric population. The study consisted of a baseline questionnaire and a 10-year follow-up examination. Medications taken by each participant were recorded at the baseline. The results indicated that participants with a hearing loss were taking a greater amount of ototoxic medications. Many of these participants were taking medications as a result of chronic illness, as stated previously, such as heart disease or diabetes. Overall, ototoxins showed exacerbation of presbycusis. The article noted that physicians must take into account the benefits versus the harms of prescribing ototoxic medication, as they can increase hearing loss in the elderly population faster. Chemical agents. So the class of chemical agents found to be potentially ototoxic include organic solvents, heavy metals, nitriles, asphyxiants, pesticides, and herbicides. Organic solvents, however, are the most common perpetrator for hearing loss. Depending on the compound exposed to, the chemical agent may target different locations in the auditory system. Generally, this is a risk in occupations such as painting, construction, furniture making, leather, metal, and fiberglass production, fueling cars, radiator repairs, pesticide spraying, and more. These jobs generally have both ototoxic risk factors as well as loud noise exposure, and you would need to prepare yourself by wearing protective gear. As for noise exposure, many ototoxic agents have a synergistic effect with noise exposure on hearing loss. Ototoxic agents can add to the effects of noise exposure. Harmful sound characteristics are dependent on duration, intensity, sound spectrum, and temporal distribution. An individual is more susceptible to hearing loss from ototoxic agents when surrounded by intense noise exposure. To put this into perspective, in 2009, Noise Health published an article that discussed an animal study revealing the effects of hearing loss and noise exposure. So noise exposure and ototoxic agents, in this case aminoglycosides, do not need to occur simultaneously. 3 groups of animals were studied. 1, high-intensity noise alone. 2, low-intensity noise and 200 milligrams of neomycin. And 3, high-intensity noise and neomycin. The threshold shifts for conditions 1 and 2 were not very significant. Only 17 and 26% of outer hair cells were lost, respectively. However, the third condition, outer hair cell loss, was close to 100%, proving that high-intensity noise and the use of ototoxic agents do have an effect on hearing loss. As far as prevention goes, it is best to speak with your physician and audiologist to discuss further prevention plans. It is suggested to record your hearing both before and after treatment. In instances where drug therapy cannot be changed or eliminated, an audiologist can help the patient to cope with the hearing loss effects. So, concerning heart disease, you would rather treat your heart disease rather than your hearing loss. So it's kind of a balance of outweighing the benefits versus the risks. In industrial settings, substitution, isolation, and local ventilation can help a lot to control chemical ingestion and reduce the amount of harmful effects of exposure. Personal protective equipment, like I talked about earlier, should definitely be used, like protective face masks and gloves, to reduce the amount of chemicals being ingested and coming in contact with the skin. If possible, substituting solvent-based products for water-based products can lessen the harmful effects as well. Workers should be well informed and educated of the risks associated with exposure as well, and it is legally mandated that they are told these risks before they work. Lastly, just read the labels of hazardous products carefully and use them with caution. Here are my references, and if you have any questions, please let me know. Thank you for listening.